and is encoded. So we've talked about many things, resilience. We've talked about, ways that we're more susceptible to PTSD and things like that. So what are the consequences of PTSD?
There are many. Imagine just feeling stressed and anxious and unsure all the time. Your ability to focus, your ability to have relationships, your ability to remember things, your ability to learn. You have increased risk for chronic depression, chronic anxiety. All other diseases like OCD become amplified. One can experience them, other things as phobias or somatization disorders where we experience pain for which there is no obvious pain. Such as in phantom limb syndrome. Other things include headaches, migraines. There is a whole raft of symptomatology that is produced by this chronic, inescapable production of stress hormones due to the activation of these AMPA receptors and the release of stress hormones.
Got it. Thank you.
So what happens is that people and physicians tend to treat the symptomatology. They'll treat the migraines, or they'll treat the anxiety, or they'll treat the phobia, but that doesn't treat the underlying disorder. That is the encoded event which leads to these things. So it becomes very frustrating, and it's very difficult for these people to get better because we're not treating the underlying issues. And that's the encoded process in the amygdala.
Got it. So, can PTSD actually be cured?
Yes. Now, there's not even a question in my mind that PTSD can be cured. I've cured it many, many times on individuals. The way in which we do this is very gentle. Now, we had mentioned the idea of havening touch and producing this delta wave. Now, what's really, really cool is that it is this delta wave which acts as the electroceutical, which depotentiates the AMPA receptor, removing it from the surface of the amygdala. So now that stimuli, which would normally cause the release of stress hormones and activate the stress response, no longer can do so. And the body down-regulates and returns back to what we call its homeostatic level. That means the normal functioning level. So we can cure this by having the individual activate the memory of the event. And what this does is it causes the membrane on the AMPA surface to become depolarized. This is going to get complicated real quick. Recall of the memory causes the membrane on the surface of that neuron in which the AMPA receptor is present to become depolarized, which then activates another channel on that neuron, which are called the voltage-dependent calcium channel. This allows calcium to enter into the cell. When the delta wave comes along, it interacts with this voltage-dependent calcium channel, and depending on the frequency of the wave of the delta wave, opens and closes this voltage-dependent calcium channel, allowing calcium to enter. So if we have a 1 hertz wave, what happens is on the upswing of this wave, the voltage-dependent calcium channel opens and allows calcium to come in, and then on the downstroke of the wave, it closes. So we produce an oscillatory calcium wave within the cell as the wave passes over this voltage-dependent calcium channel. And this oscillatory wave is like a frequency modulated wave, just like a radio, FM radio. And we can tune in to this frequency modulated calcium wave by a molecule called calmodulin, which picks up the calcium concentrations going up and down. And this calmodulin then interacts with another and another and another enzyme, which then removes these AMPA receptors from the surface, permanently removing them, and hence curing the trauma, because unless we replicate exactly the same conditions which we had to begin with, inadvertent or purposeful remembrance of the event no longer causes the stimulation of the stress hormones. Okay. Yeah, I know it's complicated. It's actually even more complicated, but it's brilliant. Nature is so brilliant in this way, and how this works.
Are there any last insights? Anything else you want to share about PTSD before we wrap up?
Yes, I think it's important that people understand that people are not broken. I think these things are really just wounds like any other wound in life. You know, we tend to pathologize many things, and we have to try to avoid this. These are wounds like any other wound on our body, and we need to treat it as such. And so if we can find a way, a gentle way to treat these things, then people should try to seek out these things. Most people think that sitting and talking will just waste their time and their money. And truthfully, the American Psychological Association and everyone else says talk therapy doesn't work on PTSD. And that's because it's in the subcortical level. It's below, it's stored below the conscious level. And so what you want to do is find some sort of person who understands how to reach below. And the way we do this is by using electroceuticals, in particular the delta wave. One more story about why the delta wave is significant, which I think is part of the evolutionary biology of this all, is that when we're born, as I had mentioned, the mother strokes the child and to comfort it. And guess what wave is generated in the infant's brain? It's this delta wave. So we are this touch is hardwired in all of us, in you and me and everybody, so that by gentle, soothing touch, it produces a delta wave in the brain. And that wave does exactly the same thing it did when we were just born. It tells us we are safe. And that's why we call it havening, to put into a safe place. And by doing so, one of the criteria for encoding a trauma is removed, that inescapability. And the trauma then becomes cured. It's pretty cool.
It is definitely very cool. Thank you. I appreciate you doing this again, Dr. Ruden, and for all the work you do.
Appreciate it. Thank you.
And thank you everyone who's tuning in, who's watching or listening right now, for showing up for yourself. And we will see you on the next one. Take care, everybody.